A doctor on the North Shore is saying that COVID-19 orders are causing a major secondary health care issue. State health leaders say the orders are to protect frontline workers as well as patients, but neurologist and pain management doctor Chad Doming is saying that postponing elective surgeries could lead to the loss of life down the road. Dr. Doming, thank you so much for joining us. And this is a major issue for a lot of people. They had elective surgeries planned for all kinds of things, cancer, knee replacements, and those surgeries have been postponed.
Yeah, that's exactly right. To put the issue a little bit simpler, 70% of all medical services in our country are at a halt right now. You're talking about chemotherapy, radiation therapy. In my field, I can't do spine surgeries. I have people sitting at home in severe pain, and I'm seeing them over telemedicine, and I'm basically just saying, suck it up. We can't do anything. We're kind of at a standstill.
Sure, and we say elective surgeries, but that's a bit misleading because these are really, in some cases, life-saving procedures.
There's nothing elective about it. It's easy to look at something and say it's elective when you don't have the disease process. Now, you can make an argument that these are not life-threatening procedures, but when you look at people with cardiac disease, spine disease, neurologic disease, cancer, and you're delaying imaging, you're delaying physical therapy, you're delaying surgeries, procedures, chemotherapy, radiation, you can see how each day that passes, these patients with chronic disease are becoming more and more unstable. And when things open up, what I fear is going to be a second wave of sicker, younger patients that are going to hit our healthcare system that we're not going to be able to get stable again because they've been sitting and incubating so long with no medical treatment whatsoever.
Sure. So what do you think should be happening? Should we be doing elective surgeries or resuming those sooner?
Absolutely. I think it's, when it first mandated, I immediately told my colleagues, do they realize what they're doing here? So, for me, what I'm trying to do is get the word out because a lot of these patients right now have no voice. Everything on the media, everything on social media is about the COVID-19 virus in the front line, which I certainly understand. It's a significant pandemic, but no one is having this conversation for these patients. So to me, we need to open this up immediately. I don't know how these medical services are not considered essential, but yet you can go to the lawn and garden section of any store and maximize the sales that are going on right now. This is absolute insanity. These patients are home suffering. They cannot get medical services, but yet you and I can go through a drive-through daiquiri tomorrow and buy one without any issues at all.
Sure, and I actually know someone who was supposed to have an elective surgery that was postponed. They are now concerned that when things resume in May, they're concerned about being in a hospital where they're afraid they could catch coronavirus. What do you say to patients who are worried about being in a hospital right now?
Well, when you say those things, what most Americans need to understand, my hospital in Hammond, Cypress Point Hospital, represents the majority of hospitals in America, which is we are pretty much 95% closed. So my hospital pretty much is empty. Even when you look at these bigger hospitals, such as in my neck of the woods, St. Tammany, Lakeview, North Oaks, they're about 50% empty. So it's very easy to isolate the COVID-19 patients and make sure that they're not integrated with these elective procedures. But again, when you're looking at these outpatient type of hospitals that we have, we don't have any sick patients here. We have no patients. We are completely shut down. So the 700 to 1,000 procedures and surgeries we do a month is zero. Wow. So all these patients are just sitting at home suffering. I can't get MRIs. I can't get physical therapy. I can't do infusions for people with unstable neurologic disease. So I don't think the listeners at home and the laymen understand how severe and how major of a problem this is and how this is growing every day. And what I fear is when we finally start having this conversation and we finally realize it's a bad problem, it's too late. The bomb's already been set into motion. And as these patients flood the healthcare system, they're going to be unstable, and the hospitals at that point will truly be 100% occupied with the inability to take care of these unstable patients.
Yeah, Dr. Doming, it's another really terrible side effect of this coronavirus pandemic. Thank you so much for joining us to speak about the issue.
I appreciate it. Thanks for having me.
All right, guys, we'll be right back.